So if I had my magic wand, it would be to, the first thing is stop scaring your patients. This is what I want to say. And, we have these studies showing that when people are given scary interpretations of the MRIs, they have worse outcomes when they're given, benign or more accurate interpretations of the MRIs. Like, yeah, you have a little thing here or there, but tons of people have it. Don't worry about it. Whereas like you have degenerating discs at L4, L5, and and then like so. So my message would be, let's scare our patients less.
This is a topic that both really drives me and really upsets me, and I call it like imaging fear mongering. So when I get patients, I had 3 patients today who I said like, "Oh, you have back pain. Tell me about your back pain. Where do you feel it? What does it feel like?" And the response is literally, "I have an L4 and L5 disc. I have arthritis." And I said, "That's not a feeling. That's not what your back pain feels like. That has not." But clearly someone has told them, and then the next thing is, well, my primary care, my surgeon, my whatever told me that my MRI looks really bad. I mean, I've had people literally come crying because of their MRI, and this needs to stop. There is very little that you can see on an MRI that should cause anyone to cry. And this is how people end up having surgery that they don't need. This is how people end up on medications they don't need. This is how people end up with an epidural abscess because they've had an injection they didn't need. There are plenty of interventional treatments that are valid. There are plenty of surgeries that are valid. But we need to stop driving our clinical practice by imaging. And I really think that it comes down to physicians and other healthcare providers, because I think what happens is that they have a patient, they're in a lot of pain, and they feel that they must give them something that is concurrent with their 10 out of 10 pain. And so they read the MRI report, they're not even looking at the MRI, and they make it into this big thing, and they truthfully, they have no idea what they're talking about. So they're like, "Oh yeah, you got a big L5 disc bulge, like that's causing your back pain," except for the fact that disc bulges don't cause back pain. So I mean, that to me tells me that these people have no idea what they're talking about. So if I could wave a wand, it would be that we stop relying so much on imaging, we stop scaring patients about their imaging, and that we're honest about what we know and don't know, because patients are completely fine, it turns out, if you say, "I don't know, but I'll send you to someone who knows, but I can't give you an answer."